All right, well, I'm going to officially welcome everyone. And so welcome to Lunchalytics 55. And the overall theme today is analytics in the social sector. So thanks for joining us. We have three fantastic guests coming to you from the Bissell Centre. That's Maria Savidov and Jacob Koziel, or Koziel, I'm sorry if I mispronounce your names. And from Homeward Trust, we have Duncan Scott. All of them are research and business analysts and evaluation analysts. And they're going to be talking about measuring self-sufficiency at the Bissell Centre and poverty reduction. Duncan is going to be talking about analytics in the homeless serving sector's response to COVID-19. So timely topics, and I'm looking forward to hearing what we're going to discuss today. As always, I want to give a shout out to our sponsors. We have the NATE Computer Training Center. We have our perennial Startup Edmonton sponsor who sponsors the venue, even though now it just sits there empty. We have Alberta Blue Cross. We have ATB, and we have Dark Horse Analytics, and that's where I work. So last thing before we get into the first session, if you are interested in being a sponsor, we're looking for sponsors for next year. So if you represent an organization that you think could benefit from sponsoring this, I can say this. A number of our sponsors are using Lunchalytics as a target environment for hiring quality people. So it's a fantastic place to both meet the community, see what the best practices are, to get your name in front of the right kind of analysts who are doing fantastic work. So if you want to sponsor, I think it starts at around $1,000 to sponsor a single event, but we're mostly interested in those who sponsor a whole season. And that's, $5,000 or $10,000. And we would love to have your name up here on the famous Lunchalytics site, well on its way to becoming as big as 10. So take it away, Maria.
So can everyone see Jacob's screen there?
Yes, we can.
Perfect. Awesome. So hi, everyone. It's a pleasure to be talking to everyone here about the work the Bissell Centre has been doing with data. And for those of you who might not know, Bissell Centre is a community agency that seeks to empower people to move from poverty to prosperity. And we've got a variety of different programs, from childcare to housing, eviction prevention, employment, mental health, victim services, just a lot of different ones. And of course, we collect data on all of those. And so just to speak a little bit about our analysis and evaluation team. So on the next slide here. So I'm the business analyst, which means that I design operational data systems that fit our context and our data needs, as well as I do try to ensure that we have the right tools and they're being implemented correctly. And I collaborate really closely on a lot of different projects with our research analyst, Jacob.
Hi, everybody. My name is Jacob. I've been working actually at the Bissell Centre since December of 2019. And basically my role is having to do with anything and everything revolving around research, whether it's literature reviews, report writing, Tableau dashboarding, as well as designing research studies and analyses, conducting qualitative and quantitative analyses, and also program evaluations as well. And I, as Maria mentioned, working very closely with, we both work very closely with one another. And and it's just me and Maria who is part of the analysis and evaluation team.
Perfect. So the next slide. Perfect. So the goal for this presentation will be to provide a brief overview of the data that we have, and also some examples of the types of analyses that we've been able to do and what we're hoping to do in the future. So I'll start with an overview of the types of data we collect, and then I'll speak a little bit about the self-sufficiency matrix, which is the central tool that we use to measure participant outcomes. And then I'll hand it over to Jacob to talk about the types of reliability analyses we've been able to do so far, as well as an example of one analysis we did for one of our evaluations earlier this year using self-sufficiency data. Okay, so in terms of the data that we collect, our workflow starts with our intake assessment, which we call a starting point. So at this point, we collect some demographic information, as well as some information about the life situation of the person using the self-sufficiency matrix. And then, so once we get a better idea of where the person is at and what their needs are, we then, along with the participant, determine the right referral, internal or external, and then the data we collect around that are things like wait time, where they were referred, what kind of referral it was, housing, employment, that kind of thing. And then when they land in case management, of course, we have case notes, different types of activities that the workers do with the participants, maybe other referrals that they need, and as well as program-specific data. And then also, finally, at various intervals, we will do a post-assessment with the self-sufficiency matrix to assess how their life situation is changing or not. Yeah. So, did I lose you guys? Okay, no, we're good.
No, we're still here.
Sorry, I'm having some issues. We're good. All right, so as I mentioned earlier, we have a lot of different types of services and programs with a variety of funders and reporting requirements. And so, as you can imagine, this can get very disjointed and siloed if left unchecked. So to answer the question, are we moving the needle on poverty? We have created the starting point process I mentioned before as a way of weaving a common thread through participant outcomes within the organization. And then we selected the self-sufficiency matrix, which has been used in various social work and academic settings as our primary measurement tool. So it currently measures participant self-sufficiency in 6 different domains: mental health, physical health, support network, employment, financial well-being, and housing. And the steps in this scale are 1, in crisis, 2, vulnerable, 3, stable, 4, safe, and 5, thriving. So Bissell Center's self-sufficiency matrix has undergone a bit of a makeover since 2015 when we first started using it. And what a fun time that was for everyone at Bissell. But I'm super glad that we did the makeover, in part because when we did that, we discovered that the inter-rater reliability results for the first version were actually pretty poor. So we had average agreement of 30% and inter-rater reliability indices of about 0.50. And then with the changes, it's now around 80%. And Jacob will go into further detail on that. So the makeover in a nutshell was such: we lowered the number of domains from 12 to 6, built in a mandatory certification process for staff where they have to get at least 80% correct answers when coding a sample story. And most importantly, we replaced the subjective ordinal scale format for the domains with a series of conditional yes/no questions. So this format was actually developed by LifeWorks in Austin, and then we adapted it to Edmonton's context. I'll tell you a little bit about the process we used for inter-rater reliability. So in the first version, we had 19 staff members listen to a fake interview, and they coded it. And then we looked at how consistent individuals were with their scoring measured against the answer key. And then in the second version, we actually used the data from our certification process to measure that reliability, since it was mandatory for everyone to complete it. And don't worry, we only used everyone's first attempt at certification, including if people didn't pass their first time. So because I know everyone here will have excellent questions I just want to take a minute to give you a little bit of context of doing data work in a nonprofit and just highlight the differences within academic context. So all of the data we have is collected by social workers who are balancing their time between providing essential services and entering data. So the data we collect, it must be streamlined, it must be essential, it must be user-friendly, and it has to provide valuable insight to the workers collecting it in the moment, participants receiving services, and supervisors monitoring program success. And it has to serve operationally to make decisions about where to refer participants and inform case management as well. So it's not just for research. So as analysts who are greedy for truckloads of perfect data, we have to keep that balance and be creative and sometimes kill 2 or 3 birds with one stone. So with that in mind, I will turn it over to Jacob.
Awesome. Thank you so much, Maria. And the first question some of you might be asking when it comes to inter-rater reliability analyses is why? Why do we do these types of analyses and in these exercises, and what did it serve us? Well, it was very important for us because we have a fantastic and large group who works at the Bissell Centre, and we want to make sure that all the data that is being entered is entered consistently across all staff who are conducting starting point. And we want to know not only is the data reliable and accurate for data analytic purposes, but also, and more importantly, it's ensuring that the community members who are seeking help are being referred to the right programs based on their SSM scores as well. So we want to make sure that before doing any types of analyses and before moving forward, that the data is being entered both accurately and consistently as well. So to measure this, we did a series of inter-rater reliability tests in 3 rounds that Maria talked about and alluded to in the previous slides. The first round is where we utilized the first version of the BSSM, while the second and third rounds are where we utilized the second version of the BSSM as well. And the purpose of the exercise was to determine the level of rater agreement with the answer key in each of the stories that we had read. So we had 2 objectives for the inter-rater reliability analyses, the first of which is assessing the level of agreement between raters and the answer key for each story. Now, initially, when with inter-rater reliability, you would have raters rate different participants and then measure the consistency across raters for all participants. However, for us, we had to contend with the fact that raters have only read 1 story per round. And as such, what we did is we created confusion matrices for each rater per round. So on the right of the slide, at the top here, for our first objective, this is just one example of a confusion matrix, whereby the correct answers by the answer key would appear at the top here, and the answers that the raters give would be located here. And then we would measure the level of agreement using these 3 inter-rater reliability indices: Krippendorf's alpha, Wed's AC2, and Brennan and Pritiger's agreement coefficient. And we weighted these given the fact that the scales were on an ordinal scale as well. For our second objective, we also wanted to assess the level of agreement per indicator that we talked a little bit about before, those 6 and 12 domains. And so what we did is we created a table, we replicated the methods from Richmond and coworkers, which took a look at the distribution of error scores by the different domains. So participant accuracy ratings are calculated by subtracting the correct score from the answer key for each domain from the score given by the participant. So using this method, the most accurate value is 0 because there's no difference between the answer key and the correct rating. While a positive value means that the rater scored the case study a bit too high per domain, while a negative value means that the rater scored the case too low per domain as well. So moving on to the results of our inter-rater reliability, what Maria had mentioned in the previous slides is the first version of the reliability revealed extremely poor scores. So we had an average agreement around 30%. Our indices scores basically varied between 0.2 to 0.46. And also when we take a look at the error scores per indicator, as you can see here, we had a high number of errors associated with it. So for example, when it comes to housing, we only had 26% of the participants actually had accurate ratings based on the answer keys. So again, we had very high number of errors and low agreement and consistency with the rater indicators. But after we made the changes that Maria talked about in the previous slides with round 2 and 3, we can see that the scores actually improved for both the indices scores that you see here, as well as the number of errors or lack thereof in the second and the third rounds. So for example, with housing, 26% of staffs actually accurately put the right answer for the fake participant story, whereas when it came to the second round, 96% of staff put the accurate put an accurate rating for the housing domain scores. Now, the other thing to mention, however, is that when it came to the financial domain, we can see that only half of participants put the right answer for the story. So what we did between rounds 2 and 3 is we actually modified the financial decision trees a little bit. And after these modifications that we made, it actually improved from about 50% to about 91% as well. Now, the other thing that happened actually was the fact that while we had a 91% of staff in the round 2 actually had accurate physical scale scores, that actually decreased to about 66% in the third round. So one of the lessons that we learned from this inter-rater reliability exercise is the fact that the stories that are given to staff really do have an impact on the scores and the consistency. So after the pandemic is over, one of the things that we're hoping to do is to actually have a representative sample of staff read through more than just one case story, read through more than one participant, and then look at their inter-rater reliability, which would, I think, give us more of an accurate level of inter-rater reliability and consistency, and kind of a gauge as to how well and consistent are staff coding participants with the changing stories as well. So now that we have evidence to suggest that the changes that we made to the self-sufficiency matrix improve the reliability of the data being entered, let's finally dive into some of the data. And first, let's take a look at a descriptive snapshot of who's been coming to the Bissell Centre. And we're going to take a look at the time period when we first launched the starting point in July of 2019 up until the middle of December 2019. So first, we'll take a look at the number of starting points that we conducted during this timeline. So in total, between July of 2019 and December, we had 928 starting points or intake assessments done. You can see that after July, the number of intake assessments by month was fairly consistent. And you can also see that there is this dip in December. Now, this dip in December was actually due to the fact that we only collected data just before the Christmas break. So it wasn't the full month that we were able to collect the data. At the top here are the groups that accounted for most of the intakes that were done at the Bissell Centre. So for example, 61% of the people who came to the Bissell Centre during this timeline identified as male, whereas almost 3/4 or 74% were between the ages of 25 and 54. 45% identified as Indigenous, and 83% of intake or individuals who came to the community to Bissell Centre were Canadian citizens. 63% were single with no children, and 65% had at least one income source. And what I mean by income source was that they had a full-time, part-time job, or were collecting some sort of benefits, such as niche. So now that we have a broad understanding of who our clientele looks like and who's been coming to the Bissell Centre in 2019, we're also hoping to provide a very quick example of how we were able to use our starting point data as part of an evaluation that we conducted earlier this year that was focused on financial coaching. So for this evaluation, we were asked by one of our funders, Prosper Canada, to report on the number of financial coaching sessions, as well as explore the association between financial well-being and demographics. Now, for this presentation, I'll only be focusing on the latter, namely looking at predictors of financial well-being at Bissell Centre. So to answer our question, we used a regression methodology, namely an ordinal logistic regression modeling methodology, given that our dependent variable financial well-being was scored on a scale from 1 to 5. For this analysis, univariate and multivariate logistic ordered regression models were created to determine what characteristics are associated with being in crisis regarding someone's financial well-being, which is one of the domains that was discussed earlier. We used a purposeful selection procedure to build our models as opposed to stepwise or other strategies. Now, a key advantage of a purposeful selection procedure, in this case, it's the capability of retaining important confounding variables that could be eliminated in earlier steps using other model building strategies. outcomes. And so this could potentially result in a slightly or even far more richer model. And during our model building, we assessed for multicollinearity using variance inflation factor, and we also checked for important assumptions, such as the linear assumption of our continuous variables, which was age, as well as the proportional odds assumption for ordinal regression using the Brandt and likelihood ratio tests. We also used the Polkstenis, Robson, Hosmer, Lemonshow, and Lipsitz tests to assess for model fit. And given the fact that our data contained missing observations at around 5%, we also conducted Little's test, and we found that the data was actually not completely missing at random. So what we did is we compared our multivariate results using a list-wise deletion method with another using a multiple imputation method, and actually found that there was very little, if any, difference between the two models. So we ended up going with the multiple imputation model as well. And so given that our model was dependent, and that our dependent variable for our model was financial well-being, we also included 5 variables in the final multivariate model, which included age, gender identity, income, whether the participant had children, their ethnicity that they identified with. And then we were thinking about incorporating Canadian citizenship, but during the model procedure building, we actually ended up dropping it from the full multivariate model as well. So here, we're taking a look at data on 281 individuals. So you remember back when we had 928 people who had a starting point done from July to December of 2019. Well, 285 of those had an SSM score based on their financial well-being. And from those 285 individuals, 4 individuals had missing financial well-being scores. So we took them out of the sample. So our total sample size for this particular analysis was 281. So as we read through the table here, we can see that all the males who had a starting point 2 done, 15% were in crisis with their financial well-being compared to 7% of females. 17% of those who had no income source were in crisis with their financial well-being compared to those with at least one income source. The median age for those who were in crisis was 35 compared to 37 who were not in crisis, so not really much of a difference there. And then 12% of those who had no children were also in crisis with their financial well-being. Additionally, those who were 13% of those who identified as Indigenous were in crisis with their financial well-being, and 11% who are Canadian citizens were also in crisis with their financial well-being. Now, as we look through the odds ratios and the adjusted odds ratios, we can see that only 2 variables were associated with financial well-being, that being age and identifying as Indigenous. For age, we can see that each 1-year increase in age, the odds of moving from being in crisis to higher levels of financial well-being is 1.3 times, given that other variables in the model are held constant. And we also found, actually, when we took a look at the different age groups, that individuals who were older than 45 actually had higher percentages who were not in crisis with their financial well-being. So we classified age as a binary variable, those who were greater than 45 and less than 45. And we found that those who were younger than 45 had a significantly, was associated with a lower probability of reporting better financial well-being scores. So those who were older than 45 had better financial well-being scores than those younger than 45. And then lastly, identifying as Indigenous was associated with lower odds of reporting good financial well-being. So specifically, if the individual identified as Indigenous, their predicted probability of being in crisis was 13%, and their predicted probability of being vulnerable, so the number 2 on the 1 to 5 scale, was 79% as well. And their predicted probability of having stable, safe, or thriving financial well-being was about 2 to 3% as well. So if someone is Indigenous, based on our sample, the predicted probability of having their financial well-being score defined as stable or safe or thriving decreases as well. Now, before we break off into the summary slide, I want to just very quickly note that you might see here that interpreting an ordinal regression and their odds ratios is a little different than your standard binary logistic regression. Given that oftentimes in the binary logistic regression, not always, but often, anything above a 1 usually indicates that there's a higher probability of a negative event happening, whereas anything less than a 1 is usually the case that there's a lower probability of a negative event happening. But remember here that our dependent variable is on an ordinal scale. So with lower scores, it indicates worse outcomes, and higher scores indicates better financial well-being scores. So an odds ratio of greater than 1 suggests increasing probability of being in a higher level of financial well-being scale, whereas the opposite is true for an odds ratio of less than 1. So I just wanted to mention that. So to summarize what we talked about today, and before we break off into the Q&A, the data that we have here at the Bissell Centre really provides us with a lot of tangible benefits. The first being that, of course, it improves our knowledge about who's coming to Bissell Centre, but it also helps us adjust our programming if we're needed. So in the previous example, we saw that those who identified as Indigenous and who are younger than 45 have worse financial well-being scores. So it suggests that we should probably take a look at the literature and look at to see if there are any tailored evidence-based practices for those groups as well. And it potentially may also allow us to see if we potentially may need to tailor our programming surrounding those and focus our efforts surrounding those risk groups as well, potentially down the line as well. But also the data that and the databases that we have allows us to not only address funding requirements, because sometimes we have, well, oftentimes we have to write reports for funders as well, but it allows us really richer report writing, because it allows us to, you know, basically highlight whatever we need to, or that we can highlight in a report to funders as well. So it really makes our reporting a lot more richer as well. And as we talked about, in the future, we're hoping to not only improve our inter-rater liability analyses, but we're also hoping to do certain outcome assessments utilizing pre-post test designs as well. And also with more data, we may have an even greater sample size as well. So I think that will only improve our analyses as well. But really, at the end of the day, Maria and I's work is really focused on wanting to eliminate poverty in our community as well. And we're hoping that our data and the work that we do will advocate for program success and policy change at sort of the macro societal level, but also we hope that our work will both improve the outcomes for community members and support Bissell Centre as a whole. So thank you so much, and yeah, we'll look forward to answering some of your questions at the end. Sure, yeah, so I see the first question's from AJ. What is inter-rater reliability? So inter-rater reliability is basically a measure of how consistent people are rating individuals as well. So you can imagine, for example, let's say there's 10 participants and 3 people, and let's say they're rating them on a scale from 1 to 10, for example. You'll oftentimes want to test to see kind of how consistent are people rating somebody. So if, for example, the first participant, rater 1, rates them as a 5, but then on, let's say, that kind of scale on whatever you can think of, and then raters 2 and 3 rate them like on a 6 or a 4, for example, right? And that continues for the rest of the participants. So basically, you can calculate an agreement coefficient, and that will tell you just how accurate people are rating, how consistent are their ratings of the individual as well. So for us, given the fact that we're really wanting people to consistently rate people and having them give accurate ratings as well, we want basically everybody to be, for lack of a better word, of one mind, basically. We want them to all be trained on accurately rating somebody on a specific scale, and we don't really want there to be different variations in how they're being rated as well.
So the next question is, were there any results in the analysis that surprised you?
Yeah, so one of the, I'll speak about maybe about the logistic or the ordinal regression one. So initially actually there wasn't actually really anything that surprised us, because when we looked at the literature, individuals who identified as being Indigenous, unfortunately, there is a literature that does suggest that they are suffering from a disproportionate amount of negative health events, unfortunately. And so, going into it, I was kind of hypothesizing that would be the case, right? That, compared to, let's say, those who are non-Indigenous, Indigenous individuals will be suffering from worse financial well-being scores as well. I was actually surprised in terms of the age finding, actually. It was actually, I didn't look at the literature before doing the analysis, I only looked at it afterwards, but I thought that those who were older than 45, let's say potentially might be retired, may have less of a chance to work, and may have a less chance to, just in general be in the workforce. I thought that would be the opposite, but actually the case, the literature does suggest that those who are middle to late adults are in the better financial well-being state. So In terms of our analysis, it basically lined up with the literature.
Okay. And just a couple quicker questions. Do staff fill out numerical values in the matrix directly, or are they answering the decision tree questions after listening to the story?
So that's a great question. So that was actually the crux of the change that we made is in that first version, we had people fill out the numerical values directly, which ended up being not so accurate. So now, now they answer a series of yes/no questions that guide them to that score. They no longer are putting in like, feels like a 3. Let's get at that in. It's more objective that way. And then I see there's another one here. Ratings on a scale of 5 works well. What was a scale of 7 too granular? So we actually we used the LifeWork self-sufficiency matrix, which was on a scale of 5. We didn't want to reinvent the wheel too much, and we wanted to use a tool that was already used in academic and other settings. So 5 works just perfect for us. Might there be benefits to having a standardized self-sufficiency matrix used by different organizations like the Bissell Centre and in different parts of the country? Absolutely. I think having a shared data set is really, really important when we think about working together and making an impact together with other organizations where we're not in a silo. And I think we can really increase our sample size and learn a lot about the different, you know, the different problems that are facing our communities and problem solve together. And there is already work being done on trying to centralize our data between different nonprofits. I know PolicyWise is doing an awesome data dictionary project that we are excited to take part in. So, yeah.
I actually like I was actually looking at the next one where it says brief overview of the purposeful selection procedure when building the model. I'll probably need maybe a little bit more time to probably talk a little bit about it. But basically it was after the way that and this is again like a sort of a very like, kind of a very like not like a very detailed answer, but basically after we just conducted simple ordinal regressions, what we then did after a series of tests, we actually had a model where we only had the significant variables incorporated like in a multivariate model, and then we had another model which was more fuller model which incorporated the significant and the non-significant variables as well. And then we actually compared the coefficients between the two, and if it was higher than 15%, we would know that there are indeed confounders present, and we would need to include the fuller model, whereas if it was less than 50%, and again, there really isn't any test out there about confounding, but if there was anything less than 50%, then we could go with like the more reduced model as well. So the great thing about it is that sometimes, as I mentioned before, like, you know, you can have variables that are not significant with your sample, but are extremely important to control for, and other methods like stepwise potentially may not allow you to have that ability, but a purposeful selection procedure, so picking out those specific really important variables, whether or not they're significant in the beginning, would allow you to control for very important effects as well. So.
Excellent. Well, thank you very much, Jacob and Maria. Great presentation, and I love that you're using some pretty sophisticated modeling and solving some real-world problems in the social sector. So fantastic. And feel free, you can and type them back. And on that note, we'll switch gears to Duncan Scott, who is going to talk to us about his work at Homeward Trust. So take it away, Duncan.
Thanks, Dan. Yeah, hey everyone. Let me just get my screen up so you can see that. So yeah, hi everyone. I'm Duncan Scott. I'm the Research and Evaluation Analyst at Homeward Trust. And I'm just going to tell you a little bit before going into actually the analytics and the homeless serving sector's response to COVID-19, just tell you a little bit about Homeward Trust. Right, so Homeward Trust Edmonton is the system planner organization in Edmonton and leads efforts to end homelessness in the city. There's several plans to end homelessness and across the 3 levels of government. So there are 3 plans across those levels. And Homeward Trust is responsible for coordinating the city's efforts to the community's efforts to implement those plans and realize the goals. So what's also involved in this is managing funds on behalf of all levels of government to ensure that there is that maximum impact and the performance across the sector, ourselves and agencies we work with meets the standards required. And yeah, and we also deliver key services centrally in the homeless serving system. And from a data perspective, what's really important there is the homeless management information system, HMIS, and I'll be talking a little bit about that later on, about the data, the kind of data, the amount, and then what we're able to do with it. But just tell you a little something more on Homeward Trust, which is relevant to this talk, which is how in the past 2 years or so, and I guess we'd started on the road before that, but really ramped it up in the past 2 years on moving towards an analytics-driven culture at HTE. And this involved implementing a BI program with Tableau, which focused on programs, on the programs department, so operations, and many housing programs that are running, with a particular focus on operationally relevant visualization. So data that would be useful. And as much as possible, we're still on this road, we're still progressing to try and enable, programs workers, comms workers to be able to access the information they need on a regular basis without coming to us as the middleman. There was some pros that went along with this, but I'm going to move on so that I can actually get to the crux of the presentation. Right, so this is what I wanted to show you as just one example of one of the dashboards that have come out of this move towards a more self-serve data analytics focus. This is the by name list in Edmonton, which is essentially a list of who is experiencing homelessness in Edmonton and and who require housing assistance. So this will tell you, it's not filtered right now, but it would show you what kind of housing program they would be prioritized for. Obviously, there's the demographic breakdown that you see here. And then besides the kind of snapshot in time with this real-time data, you also would be able to see the trends in time monthly and then, annually. So this is part of what we're moving towards and have already implemented, actually. Right, so data's role in Edmonton's COVID-19 response. There essentially were 2 challenges here. And number one would be that, number one would be that we need to integrate information from various sources to track changing demand. And that's both demand that's directly related to COVID and then demand that's relating to sort of that more business as usual, people already in housing, whose demands, whose support needs will either stay the same or may increase depending on maybe how vulnerable they are to contracting COVID. And that actually links to the second challenge, which is to use data to continue to support programs with regular operational data and then ad hoc data that would come up in response to this crisis. And so that speaks to the need to continue to house people who are experiencing homelessness. That hasn't stopped at all. In fact, it's been accelerated as much as possible. So those are the 2 challenges. And I want to just talk to 3 or 4, and mainly 3, I think, sort of examples of what we've been doing. And what I really want to emphasize, number one, I want to emphasize about what we've done, what have we accomplished. So that's number 1. Number 2, though, is the kind of the challenges, the barriers, the limitations probably in what we've been able to do, the time taken, and then if you look, down the line, what happens if there's another crisis? Down the line, just in terms of what are our aspirations to share data and to access it in the most easy sort of way possible. So, number 1, monitoring emergency shelter occupancy has been something that's important. So, as you know, physical distancing requirements have been stringent, and emergency shelters have had to adapt, as much as anyone else, to these requirements. And that's sometimes meant opening new sites even, at least temporarily, but to enable that spacing to be realized. So 6 agencies report daily overnight usage currently, and that data comes in the form of an email. So, I mean, I'm sure each of these agencies have their own methods of tracking, but in terms of coming to Homeward Trust, we receive that as an email. That then is put into an Excel sheet. The Excel sheet is then drawn on to produce something that goes into Tableau Public. So I know you can't access that link now, but if this presentation is shared, you can either just go to the site or follow that link. So this is what it looks like. Is we've been able to produce this, and it really is an accomplishment because it hasn't always been the case that we've been able to share the information as regularly across the board, shelters and with Homeward Trust. So this is a real success to be able to build something that's day-to-day that you can see easily. And what you see there, just to give you an idea of what does this mean? Well, snapshot, you can see occupancy and capacity. Number 2, you see that top line. It's kind of purple, but otherwise it looks gray. That's the current capacity. And you can see that we're operating under that capacity as it is. But you see the red line there. If spacing requirements were to increase by not much, up to 2 meters, right now I think that requirement is slightly below that for distance between cots. If that were to increase, you see that the capacity drops considerably to the point that it actually goes below occupancy. So that's something that we've been keeping our eye on from the start. And finger on the pulse, so to speak. You can see what's happening now, and again, what we need to do to plan to take any changes into account. So something that's related to, well, I guess it's all related. The EXPO Centre has, I'm sure you're aware, has been adapted to provide day drop-in services, 8 to 8, and then also isolation shelter beds for anyone who's experiencing homelessness and needs to self-isolate if they're experiencing or showing any COVID sort of symptoms. So when the EXPO Centre started up March 23rd, which seems like a million years ago, but it isn't. But when that opened up, this was new data that needed to be put out there again, everything is about what's happening now and what can we plan for. And it's also about transparency. It's not just about the sector. It's about anyone else who has an interest and wants to know what's going on. So this is updated every morning on a Google Doc, which is great. But it does mean again that this is a separate source of data that we draw on, we pull into Tableau Public, or rather into Tableau, which is then published in Tableau Public. And although not the most complicated thing in the world, we didn't encounter glitches. So you went onto our Tableau Public page, and suddenly you were redirected to the Google Doc, and we fixed it. But these things are just extra steps in the whole process, and that's kind of what I'm emphasizing is the various locations of data, the various types, and the possibility for mistakes or errors to be made as things are put into Tableau or translated across from different data environments. Right, so this is just very quickly, I'm not going to spend much time on it. This is what we've been able to show to date. You can see changing usage over time. The bottom line, most important probably, isolation shelter attendance tells you exactly that. What's the number of people who've been using beds in that isolation shelter? Right now, it's a lot lower than it was at the start. Boyle McQuarrie Health Centre and AHS have been managing that work on site there. But this is obviously an important planning data set for us to work with, and also the city and health. So the third EXPO related sort of case study I'd like to share with you, and this is a little bit more in depth than what I spoke about earlier about just that usage. This is about drop-in service usage, that 8 to 8 community services, 8 a.m. to 8 p.m. community services available, because agencies that ordinarily operate these community services have either had to reduce them or pause them, and then libraries and so on, public spaces have been shut down. So this is extremely important. And what this tells us, which Boyle Street Community Services has been collecting, is intake data. So it's entry, where someone slept the night before, are they homeless or not? And then that's been linked from the Boyle Street side to their client list, and which gives us a lot of demographic information and how long that person may have been homeless for, if they are indeed homeless. So this is, again, positive is that we've built this. We already have a relationship with Boyle Street, but to build this specifically data-related partnership has been fantastic. And we get this data exported from Power Apps into CSV file. And we get this daily. It is automated to an extent. There's always a chance for a glitch on that end, but I guess that can't be avoided completely. But what it does mean, obviously, is coming into Homeward Trust, and then Homeward Trust using that. There's a lot of cleaning involved. There's besides the communication that we've had with Boyle to make sure that we're on the same page. It's always the chance when you're doing something like this that data integrity is. There's a possibility of an error here or there. But yeah, I mean, hopefully not, but there's always the chance, and it does take time to verify things. So this is what we've been able to do, which is just shows the demographics, age, gender, ethnicity, and homeless status. There is more information, but this is just showing you some of the most valuable, I think. So this is a daily update. This is who used the EXPO Centre the day before. Of course, if we look at it weekly, and then from the start, we get that trend that we'd be looking for, and be able to plan for anything that might be upcoming. Right, and this is just an extension of what I was showing you in the previous slide. What I would point out is that we're able to include this housing efforts, these housing efforts, which have been central to the EXPO Centre response, or to the sector response, basically. What it shows is how many people have been engaged for housing. Who's spoken to a housing worker about their need for housing? What we can do there is then break that up, because we're able to match people through the homeless management information system. Is who do we already know among people coming to the EXPO Centre who are already on the by name list? They're already searching for housing. But then there's also people who are newly added to the by name list, which gives an indication of sort of new homelessness. I believe, although we haven't got this information in this data set, there is information on whether someone has become homeless because of COVID, or related to COVID. So the point I want to make here is that this is a real multi-effort response, with housing at the core, but with everything else being provided, because that's they're all essential services. So let me move on to just basically say that you've seen the accomplishments. I've spoken about some of the many steps involved in actually realizing what we've done. And the need is an increased data sophistication across the sector, starting from Homeward Trust and then outwards. We've what we do know as Homeward Trust, and as Homeward Trust working with agencies such as Bissell, Boyle. There are about 20 agencies that work in the housing-related sector, 16 to 20. What we do know is, using this homeless management information system, we're able to get a really unified sort of large data set of many, many people. So, HT collects and processes this information on people in the homeless management information system through ETO, which is just the program, and all coordinated access partners screen into ETO, into this database. Coordinated access partners are just all organizations, agencies in community who interact with their clients or participants. And if anyone is experiencing homelessness and requires housing assistance, they are screened onto that by name list, which I showed you earlier as a dashboard. Who is homeless in the city? So you got 60 plus organizations screening in. We then also collect information on on all the interactions that housing workers would have in that case management space. Once someone's in housing, their services that are provided are tracked, the time spent with them is tracked, and this is all to improve or to track and then also improve housing programs. And an example of what we've been able to do, which has been used previously prior to COVID and during COVID, has been something that we've called caseload analysis, which is pretty straightforward, I guess. But to explain quickly is anyone who's in a housing program, and there are different kinds of housing programs, mainly related to different acuity of needs. People receive these supports from housing workers, and they're tracked. So now we call them efforts. So these efforts are logged in ETO, and we're able to see the time spent and the type of interactions. What we've seen is that there's a very small proportion, 10%, say, of those on caseload who use a large proportion of time on we could say negative time-consuming efforts. These efforts, which we've been able to identify as being more likely to be associated with someone losing their home. Not always, but eviction being associated with that. So what we've been able to do, you can probably see there the red dots, those are the red flag efforts, which we call them. And these include efforts related to evictions, high risk, critical incidents. And it's an analytical tool which has been really, really useful. And we really need to go further down the line on this and expand. But operationally, what we're able to do is provide a list of participants to agencies, to teams, so that they're able to see, this is obviously anonymized, to able to see who on their caseload might require that little bit of extra support to stay in housing, because they, at that time they're experiencing some kind of, crisis or whatever it might be. There's also the indication, and this is where we need to tease it out more, although we've learned a lot, is how many people in one type of program should perhaps be better suited to a more intensive program. And that's where this sort of snapshot plus, trend analysis and need and community comes into this. But what I want to say, COVID related, is that, sorry, this is one forward than I wanted. Just this, a similar kind of list, similar to this, has been sent out to teams during COVID for the same reason, to say, hey, during this time where resources are especially pinched, human resources are especially pinched, bear in mind again that these are some people who might need some urgent attention, and look to them if you do need to ration your time. So anyway, that's very operational, hands-on. And a last example of what we've been able to do with this unified database, with so many organizations putting in their information and tracking many, many people, is being able to just pull addresses of Housing First participants in housing programs, and to say, just to be able to visualize where are most people staying in community, in Edmonton, with the idea that housing workers, this should help housing workers sort of avoid placing people in one area of the city. Downtown comes to mind immediately, obviously, as a centralization of housing, and if at all possible, and based on a participant's decision, this is a tool to be used to kind of expand the horizons, so to speak, as much as possible. And I just want to rush. Oh, well, here you go, is the last slide. What have we learned, I guess, is we did know a lot of this before, but COVID has really emphasized it, is that cross-sector collaboration can integrate information and performance management at the system level, so across the sector and even higher. And we can see that potential, but to realize it, we need to increase the sophistication of our data systems and the ease with which we can work with common data to really become efficient with our time and efforts, and avoid that data cleaning as much as possible. There's always going to be some of that, but as much as possible. And we look internally to start this process. We've come a long way, but we need to consolidate our data and harmonize reporting at Homeward Trust. We need to now pull back on the dashboards. There was a boom. We need to pull them back and consolidate them. But this definitely extends to just the sector. You know, not everyone, for instance, can access our the dashboards that we do have. So that this is something that we're trying to put our efforts into, is to make that available to anyone who needs it. So, and then also looking at we recognize that homelessness is a systems issue. It's not just a housing issue. And that's why the last point there just points to sharing data, accessing data across systems rather than just the sector itself. So that's where I'll leave it. If you'd like to ask any questions, now would be the discussion time. And there's my contact details.
Hi. Thank you, Duncan. That was great. So if you have questions, please fill them in on the Q&A. I see we have our first one. Jeff Bell asks, what is ETO and how is it related to Tableau?
Sure. Sorry, I'm just trying to get back to the actual presentation, but I'll just answer your question there. Yeah, so ETO is efforts to outcomes. It's just the name of the program, the name of the database that we use to gather information, store caseload information, and track activities across time. And how does that relate to Tableau? Well, the information that's stored in the database, which we're able to pull, we can then use that information to pull into Tableau to then create the dashboards that we use to either do the analysis in workbooks or just present a dashboard to our partners or to management or to whomever. So they're two separate systems that we just need to pull together.
Any other questions? Feel free to jump in. Here we are. I'll read it out. How accurate are your models at predicting who will require extra effort? Upon intake of a client, is there a way to use something like support vector machine, supervised learning to predict which clients will need extra efforts in the future?
So right now, let me just go back to that caseload analysis. That was a result of a lot of, was an iterative process of going to programs based on the information that we know we have to say, what kind of information do we have that you believe, and that teams, many housing teams have indicated would indicate sort of poor outcomes, like poor program outcomes, ultimately losing housing. And so that wasn't a kind of predictive analysis process. We have plans to do, and so sorry, to answer your question, we don't know for 100% whether that kind of analysis is fully right. What we do know is it gives an indication, especially for an operational side of things. But what the big plan is to do a deeper dive for some kind of machine learning project. There is a text analytics project on the go, which is taking a bit of a backseat right now, and especially with volunteers. We also had a datathon lined up for literally when COVID hit us. So that's also being postponed. But so what I'd like to say is we have big plans, and we have a good idea of where we want to go, but we aren't quite there yet to really know how accurate.
We have a couple more. How well can you track participants across all the agencies? Who provides names to your by name listing, and how accurate is that listing?
Right, so sorry, there were a couple of things in there. Accuracy is, I think we can say we feel very strongly about that we feel strongly that the accuracy is there. It's a common assessment tool that's used. It's called the VI Spit app. It's just basically a triage tool that's used to indicate whether someone can, they don't have housing but could possibly solve it themselves, or definitely require housing assistance. So on that side of things, it's common, it's harmonized. In terms of, and I probably lost the question a little bit there, but our partner agencies are trained on that. Many are already involved in the housing initiatives, and of course many aren't. But this has been an ongoing process of kind of partnership building and training, and yeah. But I'm sorry if I didn't answer that exactly.
Okay, and maybe we'll do one last one. Jacob mentioned about the need for consistent rating and survey. If person A rated 5, person B rated and C rated 6 out of 10, Jacob mentioned the need to compare participant ratings, but most participants' ratings score is subjective. I'm not sure if there's much of a question there, but maybe you can comment about inter-rater reliability in your context.
Sure. Well, I can. What I can say is when we look to do analysis, we look to see the success of programs or success of someone who's in program and how far along they are in terms of gaining self-sufficiency. We do have questions in regular assessments that they're self-assessed and self-reported rather, and as much as we try and use this information, so it's not, so I think it's slightly different to what Jacob and Maria were talking about. But if we're looking at the confidence that we would have in some of the data we collect, we do have to question some of it, and in terms of relying solely on whether someone has been to the emergency room and in the past year, how many times were you there? Well, it's maybe not going to be exactly what you respond as. How many times was I at the doctor in the past year? 3 or 4 or 5 or 6, who knows? It's tough to rely on that. And so that's something that we're working on and to try and see how much we can and how we can integrate that into our reporting and analysis.
Excellent. Well, thank you so much, Duncan. That was a great presentation, and again, another worthy initiative or program trying to eliminate homelessness. Thanks to all the panelists, to Jacob and Maria, and to everyone else who participated, our sponsors, and the attendees who actually make this an interactive experience. Appreciate it heaps. We will see you next month. It will be our last one until the summer break. We're hoping to get some folks from the States talking about public policy and influencing public policy through analytics. And we'll have an announcement on that within the next few days if we can land them. So wish you all the best, stay safe, and we'll see you back again next month for the final Lunchalytics of the year. Take care.